Hi everybody, my name is Theresa. I'm 21, turning 22 in a month, and I have PCOS. I was diagnosed with PCOS a month ago after looking for an answer to why I was so sick for 2 years. I gained from 60 to 80 pounds in these last 3 years. The majority of it last year. I had symptoms such as fatigue, joint pain, headaches. I did notice that I had some ovary pain here and there, but I honestly thought that that was normal. I always had a very difficult period ever since I had gotten it when I was 12. And I never knew if it was regular or not because I have been on birth control on and off since I was 12, just to regulate my periods because they were so severe, so heavy, and awful. Recently, I had the Nexplanon implant, and I just got that out, and you can't see because the camera's a little far, but it was brutal. It was a traumatic removal, and I'm going to do another video about that. But I wanted to talk about what PCOS is and bring awareness to this disorder that I have. PCOS is a lifelong syndrome, or up until you hit menopause is when you have issues with it, and you could have issues after that with insulin, depending on your body and how it works. So, what is PCOS? And I'm going to read this from womenshealth.gov, and I will link it down below as well, because they have charts and a whole bunch of other things. So, polycystic ovarian syndrome, also known as PCOS, is a common health problem caused by an imbalance of reproductive hormones. And saying that, just to add on, PCOS is not a reproductive disorder. It is an endocrine metabolic disorder, which means to get the best treatment, you should be seeing an endocrinologist. And a lot of GYNs and primary care physicians miss this because they are not specialists in the hormones, which endocrinologists are. Also, if you have insulin resistance type of PCOS, an endocrinologist can also assist you with that. Hormone imbalance creates a problem in the ovaries. The ovaries that make the egg that is released each month as part of your healthy menstrual cycle doesn't happen. With PCOS, it doesn't develop as it should, or your ovaries do not release the egg, ovulation. So, who gets PCOS? Between 5 and 10% of women childbearing age, so 15 through 44, sometimes younger, even 13, have PCOS. Most women find out they have it in their 20s and 30s. I suspect I've had mine since I was a young teenager, but I'm 21 and I'm just being diagnosed, so I could have had it since, I guess, the beginning of my menses. And women of all races, ethnicities, are at risk for PCOS. It doesn't target, it doesn't discriminate. It will basically take whoever under its wing. And it's also higher if you are obese or if someone in your family has it. PCOS is either hereditary or it is because of like a hormone issue, which is more just like a natural type of thing. So some of the other symptoms of PCOS, some of these I have that I forgot to include in my initial introduction, are the irregular menstrual cycle, too much hair on your face, chin, or parts of your body where men usually have hair, because PCOS allows you to have extra testosterone, and that's a hormone that men have a surplus of. Women are only supposed to have, 20 to 35 as their level. And a lot of women have an excess of it because of your ovaries and their hormone imbalance. There's also acne, which you can have on your face, your chest, and your back. I'm lucky enough to have it on my back and sometimes my face. Thinning hair or hair loss. I do have hair loss, so I wear my hair a lot in a ponytail because I just don't want to deal with it. Weight gain or difficulty losing weight. That's a big one for me. No matter what I did, I could go to the gym a few times a week. I could eat very clean, a lot of vegetables and protein, and I wasn't losing the weight. Darkening of skin, so like within your neck creases, your groin, and underneath your breast area, and skin tags. I only noticed I had skin tags a few months ago, and I have them all along here, one underneath my armpit, and then I think on this side a little bit. So what causes PCOS? Something I mentioned is your high level of androgens, which is testosterone, and these are what control the development of male traits, such as male pattern baldness, as well muscle mass, and all of that sort of stuff that testosterone produces. And then you have high levels of insulin. That's something that I am struggling with. I have type 1 PCOS. There are two dominant types of PCOS, and mine is type 1, which is the high level of insulin. Insulin is a hormone that controls how the food you eat is changed into energy. Everything we eat is taken into energy, and the toxins are removed through waste. Insulin resistance is when the body's cells do not respond normally to insulin. As a result, insulin blood levels become higher than normal. Many women with PCOS have insulin resistance, especially those who are overweight or obese. And then over time, insulin resistance can lead to type 2 diabetes. Luckily enough, my A1C is, I think, on the border of being pre-diabetic, so I'm not essentially diabetic, but I could be if I hadn't seen the doctor sooner. A big misconception, too, that I really want to underline: if you have PCOS, that does not mean you cannot have children naturally. There are many cases and many people I know who have PCOS, and they have been able to have kids naturally. I also know a lot of people who have PCOS, and they've been struggling for years and years. Everybody is different, and every body is different. Just because, one individual has to use IVF doesn't mean another can't naturally get pregnant in the normal time that a normal, healthy body would. Usually pregnancies are monitored by a doctor, or when you have PCOS, your doctor will try to help you the best they can. There are 3 criteria for having PCOS. You have to meet 2 of the 3 according to my endocrinologist in order to meet the diagnosis. One is the development of cysts on your ovaries. And I'll talk about it in another video, but there's something called PCO, which is polycystic ovaries. When you have PCO, that doesn't necessarily mean you have PCOS. You have to meet one of the other 2 guidelines. So the second guideline is a high androgen level, which is testosterone. That is one that I have, as well as cysts. And then the third would be an irregular cycle or an abnormal cycle. And I feel like I would fit this too because I have a very, very heavy period. Like I said, I don't know if my periods are normal. We'll have to see because I'm not on any birth control right now. I'm just going to let my body be as natural as possible. So I want to go over the medicines that can help treat PCOS. PCOS is not curable. It is something that you have for your lifetime or your childbearing lifetime. So things that help people with PCOS are hormonal birth control, such as the pill, the patch, the shot, the NuvaRing, or an IUD. I highly do not recommend the Nexplanon implant. Like I said, I'll make another video, but that is one to stay away from, in my opinion. But that could help too. And these will make your menstrual cycle more regular, lower your risk of endometrial cancer, which is a higher risk for those of us with PCOS. And it can help improve acne as well as extra facial hair. There's also anti-androgen medicines, which you can take in combination with the next medicine as well as birth control, if that's what your doctor thinks is best. These medicines block the effect of androgen, so these I think are more given to those patients who do have the extra facial and body hair as well as acne and the male pattern baldness. But they are not approved by the FDA, I will put that out there, and they can cause problems during pregnancy. The last is Metformin, and I love Metformin. Some people, take it and they don't like it. It doesn't agree with them, but that just goes back to everybody's body is different. We're all different. Metformin is used to treat type 2 diabetes, and it also helps with PCOS symptoms. It is not approved by the FDA to treat PCOS, but based on research and studies, it has been very helpful to those of us with PCOS. Metformin improves your insulin's ability to lower your blood sugar, and it can lower both insulin and androgen levels. So you can take this, and without taking an anti-androgen medication, it will lower your androgen levels, which will prevent, the acne, the facial hair, the baldness, the hair thinning, all that stuff. After a few months of use, it can also help with your ovulation as well as conceiving a child. Metformin has also been proved to assist in preventing miscarriages, which is a big deal because that is something that is a huge problem if you have PCOS. You're more high rate for miscarriage. Sorry. Recent studies also conclude that metformin also has other positive side effects, such as lowering body mass, so it will help you lose weight because it is fixing your insulin levels so that you're getting the right nutrients that you need and your body is absorbing it the way that it needs to. And it also can improve your cholesterol levels. Another issue within the PCOS community that I don't think is talked about are triglycerides and your good cholesterol. For me, I have high triglycerides and I have very low good cholesterol, and that is connected to my insulin resistance in my pancreas. So this is something that is corrected on this medication, and it has just been great. A lot of people complain that it gives them diarrhea or vomiting or nausea or really bad stomach pains, like a burning pain. For me, I haven't experienced that. I experienced it one night, and that's because I did not take it with dinner. I took it 4 hours after dinner, and it made a huge difference. I woke up in the middle of the night very ill. What I do to prevent those symptoms and those feelings, I take a probiotic every day before I eat. I take metformin with a high protein, low carb meal, usually dinner. And I take it with a full glass of water, and I continue to drink water throughout the day. Water is so important. And I know that is so like cliche and everyone always talks about it, but it is so important for your body. It pushes out the toxins and it allows your body to accept the metformin and accept all these nutrients that you need. And lastly, I take B12 every day because not only have I been B12 deficient in the past, but metformin has been shown to make your body B12 deficient. And that is something that relates to the fatigue, the joint pain, and a pleuretha. What? Is that the word though? My dog's barking. It's related to a lot of the symptoms that we PCOS patients feel. So I'm excited to make these videos. I want to document my journey with PCOS. I want to spread awareness. I want to find a cure. I hope there's maybe a cure out there or a possibility for it. I want to educate people that have just found out that they have PCOS or they're wondering if they have PCOS. It's very common, and everyone needs to know what it is. I've told people that I have PCOS, and they just, they're like, what's that? And it's a shame that not a lot of people, especially women in their childbearing years, do not know about it because it is so common. Most likely someone you know or several people you know have PCOS. So I'm just getting started on my journey. I'm a month in on metformin. I'm going up on my dosage next week, and I'm super excited about it. I am filming from my bed right now because I spend a lot of time here. I spend a lot of time at home because I don't feel good most of the time, and that's not because of metformin. That's just because I am so run down from dealing with like these insulin imbalances, the hormone imbalances, like the pain for so long. So I just really want to be a help to those struggling, and I hope I can do that. I have some great video ideas. I'd really like to cover tips and tricks for getting over the bad days of PCOS. I want to make a video solely about metformin. I'd like to make a video about maybe like health-wise what I'm doing to make myself better, and tips and tricks for those of you still struggling with all of that stuff, as well as a meal kind of video, because I really struggled in the beginning with what am I going to eat? Like, you have to eat like super low carb, high protein, low sugar. How am I going to do this? I'm already a pretty good eater, but I knew I was going to struggle. So I'd love to give tips and tricks on that, because I have found some amazing things working for me. So yeah, I hope you'll follow me on this journey, and I'd love to have you. So thank you for watching, and please subscribe if you'd like to see more. Bye.